if I see blood of any sort, I should stop. And in our case, in the dental world, what that means we have inflammation.
Welcome to Boundless B, the Hemophilia B podcast, a podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Today we're talking about something that a lot of families don't always feel comfortable discussing: dental care. For people living with hemophilia B, even something as simple as brushing or flossing can feel risky. But today's conversation is about shifting that mindset, building confidence, and understanding how to take care of your oral health safety. I'm joined by Dr. Douglas Hutchinson, a dentist and also a father of a son with severe hemophilia B. Doug, welcome to the podcast.
Hey, thank you for having me.
Of course. Well, let's start off by just telling us about your story and connection to hemophilia.
Started at birth of my son, Landon. Initially, before he was born, my wife knew that she had hemophilia, had ran in the family. Initial test that she had that told her that she was not a carrier prior to Landon's birth. So when he was born, standard protocol, circumcision's done, and found that we were having some complications. Come to realize that the hemophilia that he was tested for was hemophilia A and not B. Tests get run, find out that he is a severe B with less than 1% factor.
Wow. So there was a misdiagnosis at the beginning? Was that?
Yeah, a bit of an understanding as far as like what the hemophilia was, just from going into it, and when tested, it was tested improperly.
So yeah, I guess so that moment was probably pretty scary for you guys initially.
Yes, but we've good hands on deck, good doctors, got everything up and running, and we got the treatment that we needed. When they recognized that, hey, something's something.
With your dental background, that's what we're here to talk about today, because it can be scary if you have hemophilia B, if you are brushing or flossing and you see blood, right? So
Absolutely.
I think today we want to remove a lot of that stigma and really focus on the importance of dental care, even if you do have hemophilia B. So I guess broad sense, seeing as a parent and a dentist, why is brushing and flossing feel so scary for this community?
It's scary because a lot of times if we aren't keeping up with our oral health, our gum tissue gets fragile, and when the gum tissue in the mouth gets fragile, we start seeing blood. And in our community, instinct really is, if I see blood, of any sort, I should stop. And in our case, in the dental world, what that means we have inflammation. That means we have an area in our mouth that isn't as clean as we need it to be or should be, and that we have to actually elevate our oral hygiene as opposed to shy away.
Mm-hmm. So I guess maybe reframing some of those moments. So like if your gums are bleeding, that's not necessarily a sign of danger. Is that correct?
And it's not necessarily a bad thing. It just means that we have to get things, we just have to bring things up to where where they are healthy, where they are strong, where they can withstand a little bit of abrasion. And also, where you have inflammation means you have increases of bacteria. Where you have increases of bacteria means that you are more susceptible to having problems with your teeth, decay, which leads to further on things down the road, other than just fillings, root canals, extractions, and all those things that we do want to avoid from a clinical side of things.
Yeah, and I think this idea that avoiding the hygiene is going to make things worse.
And I see that in every population. I mean, whether I'm talking the hemophilia world, whether I'm talking general population who are not affected, that is something that I've had that conversation with countless amounts of patients. Hey, especially when we're coming back into getting reestablished with with our oral health, talking somebody who maybe hasn't been in for a year, 2 years plus, their habits are kind of starting to slide, and that's what I will tell them. That's it's going to be a little irritating, a little bit of red for time, but it's going to, just like if you had a cut on your arm and you started getting a scab and that scab starts going away, about a couple weeks. It takes a couple weeks for that soft tissue to start to actually regenerate and and become strong again. You need that new fresh stuff there to then come in strong.
Let's talk about prevention and safety, right? So what are some like good things to keep in mind when it comes to brushing and flossing? Like I know for myself, I had to unteach like vigorous brushing, right? Because I know
Absolutely.
my gums started to recede. So I switched to an electric toothbrush and it seemed to fix itself. But it's taken some years. And maybe in addition to that, maybe we could talk about flossing versus water pick. Like are there alternatives that can help with gum health?
Basically, nothing's better than a soft bristle brush. Medium and hard, are way too abrasive, and we start seeing things like gum loss, abfraction lesions on the teeth. So now you start eroding away the sides of the teeth because you're pushing too hard. You're using too abrasive of a brush on your teeth. So I mean, first and foremost is using a soft bristle brush. Secondly, there are some patients who have great benefits, as you said about yourself, with a power brush. If a patient comes in, if they're using a manual brush and every time we see them, everything looks great, or they're not having any decay, they don't have lots of tartar buildup, gums look very healthy, they can stick with that. But if we do see some of those backslides, that's where a power brush does come into play. And you touched also on the flossing. Personally, I feel nothing's better than the original comparing it to a water pick. I like to have that mechanical debridement, to be able to manipulate that floss around the teeth, be able to hug that and actually work underneath those gum tissues, because you do want to take that floss up underneath those gums too, because there is that little pocket that things can hide in. And
Mhm.
a water pick is a very good adjunct, especially some of the patients who have maybe some manual dexterity issues, maybe have some more advanced dental work already in there, implants, crowns and bridges, some of those areas that can be kind of difficult to get floss up and around. A water pick can be an excellent adjunct for those patients as well.
Yeah, and maybe something, I just thought of, I know like joint pain is a big issue with hemophilia B, so maybe a water pick could be an alternative if kind of
Oh,
manipulating the
absolutely.
floss is painful.
Yes, there are other adjuncts as well. Things like they call them proxy brushes, which almost look like a little pipe cleaner. A thing, other cleaners called soft picks, and some of those are really good because they are a little bit larger, especially if you have a bigger space underneath where the teeth contact. They can actually be a little bit more efficient for a patient, and they can help aid in not being able to get your hands in that proper position. So yes, all those things are wonderful. I wouldn't skip the flossing if we can floss, but to add those other things in to maximize your health, I think is a great benefit.
Awesome. Well, this is great. We're kind of laying out like safe and effective, habits that we need to establish twice daily. So I guess let's talk about going to the dentist, right? It's probably not everybody's favorite thing to do, but you seem like a nice guy. It's not a scary thing, right? So if if I'm a caretaker, I have hemophilia B and I'm like maybe hesitant to go to the dentist, like what are some things I can talk through with my dentist about making me feel more comfortable and safe at the dental office?
I mean, and again, dental phobia is very real. I mean, for everybody, kids to adults. I mean, it just, and a lot of it can be based off of past experiences. I still have, some older adult populations who still, require some adjunct treatments to be able to get through their appointments. And the other thing is, we are invading somebody's bubble. We're in their space. We're working very intimately in somebody's mouth.
Mhm.
So the biggest thing when it comes to fears and phobias is disclose our entire health history. We have to know that, up front, because there are going to be some protocols. There are going to be some treatment changes, not all the time, but there may be, but there may be some treatment changes that we'll have to make, things that we'll have to have on board, medication wise, timing wise, to make sure that we assure we give you the best treatment that we possibly can.
Yeah, and so is part of that work on your end as a dentist, is that like connecting to a hemophilia treatment center to make sure that there's awareness of that type of patient in your practice?
Absolutely, yes. That would be, reviewing their medical history with not only the patient, but the hemophilia treatment center, getting any kind of history and physical that we may need that from documentation standpoint. From there, then the protocol based off of the patient's severity, mild, moderate, or severe, will dictate at what levels we have to treat pre-op and post-op. The two biggest things, that I see that we have to do, we want to be safe with our injections. I always try to do infiltrations, which is just directly around the tooth as opposed to larger blocks if possible, because in your lower jaw, the nerve that we need to anesthetize to get numb runs right parallel with a vessel. It can be easy sometimes to puncture that vessel. We don't want to have any kind of hemorrhaging and bleeding in the jaw. So we try to avoid the blocks as much as we can. Sometimes we have to, but again, based on what we have to do, that's where prevention actually comes big into play. The smaller the procedure, the less robust of anesthetic that we need to have. So the cleaner we can keep teeth, the smaller that we can have cavities. A lot of times we can minimize the need for some of those other techniques.
Awesome. Well, this has been so helpful and I know insightful for so many listeners. And I guess, as we move into kind of advocacy, maybe balancing, fear and confidence for you as a parent now in that doctor's office, and you're explaining kind of what you have and the medical history, and it doesn't feel right to you, or maybe the doctor isn't as well versed. Like what do you recommend families do in those kinds of moments?
Advocating for yourself, advocating, and also having other people in your corner to advocate for you. Your hemophilia treatment center, having the dialogue and the communication between, with the doctors. If a patient's trying to find a dental provider who is versed in hemophilia and comfortable working with patients with bleeding disorders, working with the HTCs, with the social workers to try to find, the proper avenues to get to. So we know what to expect, what we have to have on board.
Gotcha. Well, thank you so much for being here. We really appreciate it. And I just wanted to end on your message of hope as a parent with someone with hemophilia B. What gives you hope, as you move into the future when it comes to, treatment of hemophilia B?
Well, I think that, we see a lot more patients who are on prophylactic treatments, as opposed to on demand. I think that has helped us as a community, leaps and bounds, especially as we progress through life and we age. A lot less issues with bleeding, joint damage. I think that's been phenomenal. I think a lot of the medications that have come out over the years, have really helped our frequency, and it's been wonderful for us. Advancements in gene therapies, to be able to reduce the level of severity of someone with hemophilia. I think all that stuff is wonderful. It just seems like every day there's there's progress. There's ways of managing things and kind of heading them off in the past before they become something more severe than the issue that we have at hand.
Absolutely. Well, and I think I may have just connected a dot here. Does your son play guitar?
Yes, he does.
Landon. I met Landon last year at Symposium, and then I was actually part of the Beats program, and I was recording with him this past summer.
Oh, okay.
Yeah,
yep, that's my boy. He's a good he's
heck of a guitar player. He's definitely got something.
He plays every day. He is he's very passionate in it. That's his motivation and his drive, moving forward. He wants to make a career of it, and I'm behind him 100% on that for sure.
That's awesome. Well, that's so fun to make that connection. But thanks again for your time, Doug. We really appreciate it.
Absolutely. Thank you.
Of course. This has been Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Remember, you can connect with your community online and in person at hemob.org/events. Until next time, everybody, take care. Thank you for listening to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Produced by me, Kai. Got an idea for the show? Send us an email at podcast@hemob.org, and don't forget to stay connected to your community at hemob.org. Anything else to add, Miles?
Yeah.
This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community.